Hey, welcome to another edition of the Trustcast Show. And we're really happy to have with us Dr. Kaye Brundidge. She's a medical doctor. She spent 25 years as an anesthesiologist, putting patients to sleep and then bringing them back. But along the way, she became a Reiki master. Did I say that right that time?
That's correct. Yes.
And trained in medical acupuncture. And now she combines both worlds as a surgery coach, helping busy women navigate the surgical experience with less fear and faster recovery. So you spent 25 years in operating rooms. At what point
Yes.
did you start thinking there was something missing in how we prepare people for surgery?
Actually, it was during my own surgical experience. I, at one point, was really avid skier, like crazy avid skier, and was doing a lot of downhill. And one day I changed too many variables at the same time, ended up with an ACL injury, knee injury. So I had to have surgery. And at that point, I was doing my thing. I was teaching yoga before I went into work. I had my own yoga practice. I think I just started my medical acupuncture courses and was working with my own yoga teacher as well, yoga and meditation teacher. And I said, you know what? I really don't have time for this prolonged recovery. I want to get in. My goal and my intention is not to have a lot of pain. I want to recover well. I want everything to go perfectly. And because I was an anesthesiologist, I envisioned what would happen, how everything would happen before it happened. And the first indication that I had was the night of surgery because they kept me overnight because they were just panicked because, coworker having surgery. And my surgeon said, you know, I can't really explain it, but everything went perfectly. He's like, even spots where I thought I was going to have everything went really well. And as my recovery and rehab went on, that was the litany that he kept saying, whatever you're doing. I don't think I've had anybody recover this quickly. I was over 40. I mean, it wasn't like I was doing this when I was 25. And he said, things went really well. And see, I had my surgery in March. In August, I was climbing a glacier with crampons. No problem. I was just doing my thing. And probably by January 1st of the next year, I was skiing. I was no more double blacks, but I was doing regular downhill skiing. And it was after all of this happened, probably about 5 or 6 years after it happened. I saw one of my friends who had worked at the hospital. He's like, she's like, he's using you as the poster child for everybody that comes for surgery. And I started thinking about it. I'm like, well, I don't think I did anything special. But then at about the same time, I realized I had started using some of the same focusing intention and envisioning techniques with my patients as they went off for anesthesia. And then I started hearing from the nurses, you know, the patient said that this was the best surgery experience that they have ever had and that they're finishing up and they're feeling that they can take on the world. And it was like, oh, okay. And it wasn't just one time. It wasn't just one place. It was pretty much every place I went. And that was when I realized that I had stumbled on a combination of techniques that was helpful and something that was very accessible and something that gave positive results. And that was when I started thinking, why don't you see if you can do this for more than just your patients in the OR? So that was really the start of it. And it took a while because of nerves, because of anxiety, and can I really do this? And then finding good supportive team with my business strategist and other women that kind of shared that same vision and who had surgical experiences that were troubling. So that was when I kind of knew that I had something that I wanted to share to a larger audience.
So I'm going to ask real specific questions because
Sure.
I want to know.
Okay.
and, and those are so exactly what did you do that was different than I might do, if what I might typically experience if I'm coming in for surgery. I've had a lot of surgeries.
Okay.
I've had 3 hip replacements, just for starters, and that was before it was. I think I was maybe around 50 or so when I had that. So that was a long time ago for my last one.
Um, I guess the thing that I do differently is, first of all, I really try to connect with the patient. And I just have always had a knack of knowing when somebody is pretty calm, amped up, or when I'm going to have to peel them off the ceiling. And my first goal when I meet my patients is to say, you know, you're going to be fine. I'm going to take good care of you. You've got a great team of people with you. So let's get you in the great mindset so that you're going to have great results. You're not going to have a lot of pain and things are going to go well. And you're going to have a smooth and uneventful recovery. And what I try to do is get buy in with the patients as far as what they want to achieve. And I let them voice it. I give them an example of, you could say this. And I emphasize that I really want them to focus on what they want. I said, the fear, yeah, I get it. I'm like, I do anesthesia for people all the time. I get it that you're anxious. But if you can just set that anxiety aside, let's not focus on the fear. Let's focus on positive. And also knowing that your support team, they're going to be sending you positive, loving energy. So that's where we want to live. We don't want to live in fear. Fear is a 4-letter word. We have to pick a better 4-letter word. Love. So why don't we focus on the most positive outcome that we can, that you have your family, your support team, whoever with you, sending you positive energy. And I want you to focus on your breath. I try to get them to not breathe in the top of the chest, which is what I call anxiety breathing, where you're just panting. It's like, let's slow your breathing down. I do something called box breathing, where you take a deep breath in, you inhale to the count of 2, you hold it to the count of 2, you exhale to the count of 2, and you hold the exhale. And I will go with them and calm them down. And that invariably lowers the heart rate. I haven't done studies with blood pressure, but I would imagine that as a side effect of decreasing anxiety, it reduces blood pressure as well. And I get them to concentrate on the outcome that they want to see. And then through the technical process of doing the anesthesia, I try to do things that are reassuring, make sure that I have plenty of medications going that are going to help them relax. And then I have what people call my airplane sleep, my airplane speech. And I tell them, pick out that nice dream, go where you want to go for vacation. I'm going to be right here when you wake up. Everything is going to be done. You're going to have the best result possible, and I will see you when you wake up. And that's basically what I did. Um, and that's what I do for the patients. And then as far as what I maintain, because energy affects all of us, I just see if I can maintain the most positive, calm energy that I can when I'm working with my patients, and extend that to the surgeon and like, hey, I want him to have or her to have the best possible surgical day. Things are going to go well. Patient's going to wake up, not going to have a lot of pain. Things are going to go well. And it's my mindset too. as well as the patient's mindset. So I look at it as a team. We're all a team. We're all working for that same positive outcome. And that's what I do.
So, so if I, so you're actually acting as an anesthesiologist during the process, if I understand this right. And so, what hospital do you work at? Just Evergreen,
Right now,
Overlake
no,
Surgery
actually, I've
Center.
been, my most recent hospital that I worked at was actually St. Joseph in Tacoma.
Okay.
And as I've been doing the business more, I work less at the hospital, started doing some outpatient, actually started doing some pediatric dental anesthesia for kids that did not tolerate having dental procedures done. So we do that under general anesthesia. And it's interesting. It's almost the same approach. You want to get the kids calm. You want to get them engaged in something other than something's going on that I'm really afraid about. Um, and there have been kids that have been severely autistic kids. There have been kids with developmental issues that I and my team have worked with, and we have gotten the job done. I mean, there have been a couple of kids that this was their last option. We're not going to be able to do this as an outpatient. They're going to have to go to the hospital. There have been kids like that I've managed to get to accept the anesthetic. And we start with the procedure. We don't do anything that hurts the kids as they're awake. And things have worked well. And I don't know. I once I realized that I wanted to do this as a business, I've cut down on the amount of anesthesia work I do. I just do kind of per diem work right now.
Mm-hmm.
But it's a matter of letting people know that my services are out there, because it is something that's so new and so different.
Yeah.
And I really try to let people know that this is something that is a thing and it's something that works, and that there's a lot of evidence that mindset and intention have a lot to do with outcome.
Oh,
Um,
sure.
yeah,
Tons
there's
of
one of the
evidence.
yeah, there's a one of my favorite sites that I actually work with these techniques. It's called the Heart Math Institute, and it's talks about how our heart is actually the generates the biggest electrical field in the body. They've done all kind of studies that show that. So getting into a space where your heart, as opposed to your brain and all of the anxiety, is driving um, your overall being, getting into a heart space that's a loving, positive heart space is a lot healthier. I mean, part of what I do meditation is I just use a phone and the camera of my phone, and it measures my heart rate, and I work with my breathing and my heart rate to get to a state that they call heart coherence. Um, it's a real fancy technique, but you can do just regular breath centered meditation and achieve similar results. So it's one of those things that I see it as harnessing something that's already there and bringing something into just the wonders that happen with modern medicine and achieving results that are even beyond what they're able to achieve now, because you're 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 harnessing spirit, you're harnessing your heart, and using intention and focus to achieve positive results.
So, if I were a scientific cynic, which I'm not,
Okay.
um, then you could still attribute, there would be a direct result here, because you could say anxiety has a tremendous amount of you can measure what's going on in the body by
Right.
how anxious somebody is. So if you're able
Right.
to reduce that, and if I was just saying only on a scientific basis, beyond the what you're talking about, you could still say that this was something that would work. Do you have to ever have that argument academically with somebody, so that you're telling them, okay, there's empirical science behind this, it's not just all woo woo.
Right. And that's the thing. It's like there is science. And You can get into the physiology of it, and the anatomy of it, and the part of our brain, which is the more primitive part of our brain that is concerned with survival. And unfortunately, the way we're wired, that's the part of the brain that develops first. And it's very hard to overcome those tendencies. And a lot of it has to do with awareness. And believe it or not, some of my energetic teachers go over the physiology. They start with the physiology and they go, this is how we are wired. But you don't have to live in flight or fright. It was one thing when, you're about to get chased by something that could potentially eat you. But in modern times, we don't really have large sharp-toothed predators running after us. So we probably should not constantly be in a state of flight or fright.
Yeah. So tell me if so do you work mostly with women or do you work with men as well?
I do work with men. The thing that I kind of have keyed into is that even within a family unit, men who are coming for surgery, it's the women who are making most of the medical decisions in the family. So women are involved in increasingly in taking care of their parents as they're older. They are taking care of their children. They're taking care of their own families. They're taking care of the network. And I just see women's effort and contribution as kind of holding our society together, kind of unsung heroes of getting things done. And usually most of the men that I have worked with the same technique, it's successful too. I mean,
Hmm.
it does cross genders, but I kind of looked when I decided to look at my target market, because that's what you have to do. I targeted women because women statistically make most of the healthcare decisions in a family, whether it is directly concerning them or not. Very much involved. So that's where I wanted to focus my attention and appeal to the women, particularly working women, since working women, we have so many responsibilities.
So tell me from a strictly pragmatic point of view how this works. So I'm gonna go in for surgery of some kind or another. Who directs me to go to you? So how do you end up with a client or a customer or a patient? Probably that's the most appropriate. How do you end up with a new patient?
I actually work directly with surgery practices, and it's something that, as I'm again phasing down the anesthesia portion of things and gearing up what I'm doing actually a surgery coach as opposed to an anesthesiologist, people can contract with me independently. I do have pretty active on social media. I've started working with doctors to uh, work with primary care doctors as well, just to kind of introduce this concept because it is a new concept. And I do take as many opportunities as I can to tell people about what I'm doing because it's not something that is very known. One of the things that I'm doing this month actually is I'm going to contact that surgeon that I used to work with and go, or oh, I'm sorry, that did I used to work with him and then he did my surgery, and I'm going to say, hey, guess what? I'm doing this full time now. Do you
So
want to work with me on
it's
this?
a full-time thing that you do. Are you busy yet or are you still trying to
I
build your
I'm
clientele or?
I'm I'm building my clientele. It's one of the things that I noticed because I've been trying to build this business and work full time as an anesthesiologist,
Hmm.
and it was not working. It was there was a lot of scheduling conflicts, a lot of times when I wished that I could be present during the workday to talk with someone, explain what I was doing. And I 2026 was the year that I chose that you're going to do this full time. And this is something that you can do as a contribution. And then with all of the changes that are coming about with our healthcare system, it's like maybe this is something that you can do that will actually help people as well who are not having surgery, who want to learn to manage their stress better, who want to learn the things that they can do individually that will work with their doctor and get them a better overall health outcome. So it's a big venture. It's a big risk. Um, but I just kept looking at the upside, and I kept feeling it's like, I can help one patient at a time when I'm in the hospital or I'm in the clinic. Maybe I can help more people. So that was actually the impetus for me to do this. Yes, it's a big risk,
So tell
but
me that
yeah.
from a pragmatic standpoint, how do you because you're like a change agent. So you're something completely different, and there's a cost associated with. There has to be a cost associated with it because you have to have income to make something like this work. So how do you? And it's insurance is surely not going to cover it. Even if you show that clinically we can show this outcome is improved, insurance is just not going to
Not going to
cover it.
cover.
So yeah,
Right.
it wouldn't matter if you could show you know that patients could walk on water afterwards for something like this. They wouldn't cover. So how do you get um, who recommends you along the way? Is it from the physicians or is it from someone else who's tried the service
Someone,
or
word of mouth, someone who's tried the service, someone who has experienced what I can do. And that's why the thing that is different now is I'm going to be working initially with docs who are organizing practice outside of primarily insurance based practices, just because there have been so many docs who have gotten burned out with the see the patient every 15 minutes and feeling that they can't deliver the type of care that they want. And yes, it's a niche market, and it's going to be a hard year. It's going to be a lot of work for me, but I feel that I've got something positive that I can offer, and I'm going to eventually get enough buy-in, eventually get enough people who know what I'm doing that they're going to recommend more and more people to try this technique because it works. I mean, it's not like it's something that I'm just making up. This is what I've been doing for my patients for, trying to think now, about 12 years. This is what I've done. Yeah.
yeah.
So yeah, it's I'm on the leading edge, like they say. This is very different, very new. I do recognize that I have an uphill battle, but I am very confident. I tell people about what I do. I mean, I go in and I buy my dog food, and people are like, they see this is when I still have my scrubs on. They're like, well, what do you do? Well, I didn't tell them just about the anesthesia. I told them about what I was doing to help people get through surgery and have a more positive outcome. And, much like you, lots of people have had surgical experiences. Wow, I wish you had been my anesthesiologist when I had my surgery. I said, yeah, that's why I'm trying to do this and work with patients directly. I have developed a whole process for patients to streamline information because I'm an anesthesiologist, and got a lot of experience with a lot of procedures. I have a whole flow sheet that I will give a patient and says, this is what you need to make sure that you ask of your doctor. Because a lot of people don't know. There's a lot of not accurate information out there on the internet. And as a part of my whole prep process, I give patients a document. And this is something that I trialed with friends of mine who were nurses. And they said, even, I'm a nurse, I know everything. I didn't know these things to ask. And when I asked my doctor, they were very happy that I had taken the time to get extra information and to know the questions to ask. And so that was the feedback. I did bits and pieces of this before I got started. I've consulted with other colleagues or anesthesiologists who had surgery recently and got recommendations about medication categories. People don't know medication categories. So, as a part of my whole process, I have a sheet where we can document all of the medications that the patient will be receiving. You take that in when you talk on a pre-op or post-op basis, find out which category the medication belongs to, and that way you have that information. The other thing that I do is I try to think of all of the things that you need to think of to prepare yourself to have a surgery. It's like, well, you got to have somebody to walk your dog. You really need someone to take care of meals. You need to watch the loose material, rugs, whatever that's in the house, so you're not tripping as you're recovering. So I have a whole packet that I give people, and I really individualize it. There's a questionnaire so I can understand kind of where people are as far as their self-care routine before they go in. And we go over that. I sit down and I say, how do you learn things best? How can I help you? What are the self care techniques you're already using, be it affirmations or meditation? What's working? What's not working? And then we get a game plan before we go in. So I have my whole plan is about 6 weeks, and that covers time before surgery, time after surgery, where I still consult and work with people as they're recovering. Um, I've done a lot of my work with friends and former clients. I had one um, former colleague that called because her son was having major craniofacial surgery, and it was a staged procedure, and this was the second one, and he had had all kind of issues before. So I started working with him about 3 weeks before his surgery. We worked
So
with mindset.
tell me a little bit about how that would work when you start working with somebody who's already went through surgery and are anxious and they so how do you help that patient?
We go over the specific fears because usually there's something. There's usually, I had a lot of pain, or I didn't know that this was going to be involved, or usually there are one or two big level stressors. So with this patient who it's interesting working with children who are still adults. So that was the interesting. The first time he had the procedure, he was a child. He was 16. Now he's a young adult in college, and didn't want mom involved, and I'm like, "Hey, I'm not going to get in the middle of that. I'm just going to work with you and your mindset and what you want to focus on." So we talked about it. We talked about pain management. We talked about things that can help with pain management. Um, we worked with his doctor in terms of things that they wanted him to do or not do. I mean, there were some things that they wanted to alter about his caffeine intake. He was not taking any type of pain medications before. He really did not have a good experience with the particular narcotics he used last time. So we talked about that. I told him a little bit about managing his pain so that he never got to a level that pain was just totally out of control. And also about communicating clearly with the surgeon. I said, they don't read your mind. If you're having a problem, you need to call in. But these are some of the things that you can do to help manage your pain better. And we got on a schedule because caffeine actually can be useful in certain instances to help with pain management. So we got on a consensus about how we would manage the pain, both before surgery and after surgery. Um, After surgery, when he was able to talk, we talked a little bit. We texted a lot because it was craniofacial surgery. So I was able to coach him, help him with problems that he was having with pain afterwards. Um, I did find out that it was a much different experience this time because a lot of things that he knew before, the pain management helped. like the caffeine. He used caffeine in moderate amounts to help reduce the amount of narcotic that he needed. And because this time he knew a little bit more about the procedure and what he could expect, he had a much better experience after the second one. So it was a matter of working with mindset and getting him to envision, okay, we're going to be pain free. This is what we're going to work on as far as breath work. When I am having pain, these are the procedures that I'm going to go through. This is how I'm going to manage my narcotic medication. This is how I'm going to manage my non-narcotic medication. If I'm having an issue, I'm going to call my doc sooner rather than later. And we're going to be really clear about side effects. And we did go through all of the medications that he was going to have. So I was able to say, okay, this medication, this is the side effect that you need to look at and or look for. And if you start having this side effect, there's another medication that you can get. Contact your doc. So I wasn't as much, I didn't see myself as interfering with what was going on with the doctor-patient relationship as much as I did coaching him. This is what you need to do. You need to be proactive about calling your doc. You need to do the breath work. You need to, as soon as you're able and cleared to get up and get out and start walking, you need to start doing that because we want you to continue to progress with your recovery period. And part of that is staying active, doing the rehab, doing the exercises that the surgeon is going to have you do.
So have you, literally you're not working as an anesthesiologist right now, or you're just working per
Per
diem?
diem.
Per
Per
diem.
diem.
Okay.
Yeah, just per diem. I do some remote work as well. There's a lot of work opportunities to work with
Yeah.
companies that are doing remote AI models and a a lot of, you know, I've got jobs that are out there with that. But yeah, it's a challenge, but I tried to do it, as I mentioned, part-time, and just the amount of energy and time I was having to do getting up at 3 and 4 o'clock in the morning as an anesthesiologist, trying to run a business that is different from being an in OR anesthesiologist, it just was
Hmm.
not meshing. So this is a big step.
So if
But
somebody's
I think
interested, how do they get in touch with you?
I have a website. My website is Oshun Energy Medicine. That's OSHUN energymedicine.com. It's you can schedule a discovery call, which is free. We talk about your interests. We talk about what the patient wants to accomplish, the type of procedure that's coming up. Um, Even though I prefer to work with people for a couple of weeks before the surgery so that we can get to work on the mindset, I'm actually happy to work with people on a shorter basis because sometimes people don't have that luxury. But yeah, I'm active on social media. I um writing video is a little daunting for me, I have to admit. So working on doing videos is a little more challenging. It's a little nerve-wracking. Everybody has something. I'm really
Hmm.
nervous about videos. But that's how people find me. And I try to go to as many networking groups as I can to tell people about what I'm doing and how I'm making it happen. Now that I wasn't going to start, even though I was ready to start by the end of 2025. I wanted to wait until we got into 2026 and the new year, and I'm going to start working a little bit more with doctors, medical organizations, community service organizations, just to let people know that I'm out there. So
Hmm.
it's a big thing, but I'm up to it. I'm
Yeah.
excited
Well,
by it, and I
congratulations. So
think I can
I,
help
I
people.
I really appreciate you being on. So hang on just a second. I'm going to wind it up right here.
Okay.
And so if you want to get in touch with Dr. K, um, or Dr. Brundidge, whichever you prefer. You
Dr.
can go to
K
our
is
web.
easy.
Yeah. You can go to our website and find out more there. And thanks for being on. So hang on with me for just a second off air.